Hello everyone, let's try to solve this question together. So here we have a 3-week-old infant who is still on ventilator. The gestational age was 24 weeks and post-menstrual age is 27 weeks. So infant is 3 weeks old. That's the chronological age. The infant is having feeding intolerance. An X-ray is obtained. The correct statement is, pause the slide, zoom the picture, look at the options. Okay, the correct response here is D, that in this case we should pause the feeding and repeat the X-ray in 4 to 6 hours. So now let's see why the others are the wrong answers. So first we start with the X-ray. So if you guys can see that this X-ray, as you guys can see that, the full abdomen is not shown. So that is something, not good about it. Any abdominal X-ray should have a chest, which is included here, and the abdomen, full abdomen, which is not there. So this is something we need to make sure that whenever a KUB is ordered, it should include the full abdomen, including the hernial orifices. So this is something not right about this X-ray. So that is one point. Point number now let's talk about choice A, that they said make the baby infant NPO and start the neck treatment. Again, this is not classical of neck. Unfortunately, because this is not a full exposure, one cannot comment. But again, treating this one just for feeding intolerance as a NEC should not be the right choice. Thinking of NEC probably will be overkilling here. So let's not do that. What about choice B, making the infant NPO and consult infant for surgery for exploratory laparotomy? Again, I don't see any free air here under the diaphragm or anywhere else. So it doesn't look like that this is the spontaneous perforation or there is some pneumoperitoneum. So again, choice B is not the right choice. What about performing needle aspiration on the right chest? Let's see. Let me rub it off so that we can see. So you see like this is the cystic changes happening here. So this is because this patient is 3-week-old and is on ventilator. So we see a lot of cystic changes in the lung. Again, this is not pneumothorax. So performing needle aspiration is not the right thing to do because this is not pneumothorax. This is cystic changes in the lung itself. It could be emphysema, which is we call it PIE, pulmonary interstitial emphysema. So that's a possibility, or this is the formation of cyst per se. That's a possibility, but in either case, the chest tube is not the solution. So I hope you guys have learned something with this case, and please do like and subscribe to our channel, and you guys have a wonderful day. Bye.